Hey everyone, welcome back to another deep dive. Today we're going to be looking into something that's been causing a lot of people to worry.
Mm-hmm.
And it's this trend of kids in the U.S. losing their Medicaid coverage.
Right.
We're going to try to figure out why this is happening, what it means for the families involved, and what people are saying about it. And we've got some really good sources to help us out here.
Oh, good.
We've got this Reddit thread where people were talking about their own experiences with this. And we've got this NBC News video report that has some facts and figures and also tells one family's story. That, I think, really helps us understand what's going on.
Yeah, that's important. It's not just about the numbers.
Okay.
It's about real people in their lives.
Yeah.
And this is a complicated issue.
It is.
There's a lot to unpack here.
Right. And one of the things that really got to me was this story about a little girl named Isabella Quintana from Colorado. She's only 16 months old, and she has a heart murmur. And it seems like because of some kind of paperwork issue, her family lost their Medicaid coverage.
Oh, jeez.
And now they're having to pay out of pocket for all of her medical care. Can you imagine getting hit with a $1,000 bill for just a follow-up appointment for bronchitis?
Goodness.
Especially when you're only making like $35,000 a year.
Yeah, that's
a lot.
A huge burden for any family.
Yeah.
And unfortunately, Isabella's story isn't unique.
Right.
Over 5 million children across the U.S. have lost Medicaid coverage
Wow.
since the end of the COVID-19 public health emergency.
Oh, wow.
Yeah.
I didn't realize it was that many.
It's a lot of kids.
Yeah.
And the NBC report, they call this unwinding.
Unwinding.
It's basically where states have to reevaluate everyone's eligibility for Medicaid.
Oh, so it's not like people are doing something wrong.
Right.
It's just
It's like a check-in
a check-in.
to make sure everyone still qualifies. But the problem is a lot of people are getting kicked off. Yeah. Not because they don't qualify anymore, but because of procedural issues or problems with paperwork.
So like Isabella's family.
Exactly.
It's so scary to think that something as simple as paperwork could have such a big impact on a child's access to health care.
Yeah, and the report talks about the potential consequences of these coverage gaps, too.
Oh, what do they say?
Well, there's this pediatrician they interview.
Okay.
And he says that a lot of kids are missing out on preventative care.
Oh.
Like immunizations and developmental screenings,
Right.
things that can really have long-term effects on their health and development.
It makes sense that those things are important.
They are.
But I guess you don't always think about it.
You don't until it's too late.
Yeah.
And that's what's so concerning about this.
So we're seeing this play out with individual families like Isabella's. But the report also looks at Colorado as a case study to see how this is happening on a larger scale. And they spoke with Kim Bimsteffer, who's in charge of Medicaid in Colorado. And she said that safety net enrollment has plummeted.
What does that mean?
So basically, it's the number of people enrolled in programs that help them afford health care.
Okay.
And it's dropped by over 30% in Colorado.
Wow.
That means over 550,000 people have lost health insurance through those programs.
A lot of people.
Yeah, and almost 150,000 of them are children.
Oh, geez.
And although Colorado has managed to restore coverage for about a third of those who lost it, there are still a lot of challenges.
Yeah, it sounds like a really tough situation.
It is.
And even Bimsteffer admits that people are falling through the cracks.
And that the state's uninsured rate is going up.
Right.
So we're seeing this problem affect families and play out at the state level. And now I think it's time to look at that Reddit thread we mentioned earlier to see how the public is reacting to all of this.
Okay.
It's really interesting to see all the different emotions and opinions.
It can be.
What are some of the main themes you're noticing?
Well, one of the things that really stands out is how emotional people are about this.
Yeah.
There's a lot of anger and frustration, and even a sense of helplessness.
It makes sense.
People are struggling to understand what's going on, and they're looking for someone to blame.
Right.
Yeah, and it seems like a lot of people are blaming the government with some specifically targeting certain political parties or ideologies.
Yeah, it's interesting how these online discussions can really show us what people think about complicated issues.
They can.
And one thing that really jumped out at me in this Reddit thread was how many people were calling for universal health care.
Oh, yeah.
They see this whole situation as like a symptom of a broken system that needs to be totally changed.
Right. That's a common sentiment you see.
Yeah.
A lot of comments like, we need universal health care. It's so bad in the U.S. and everyone knows it. Anything would be better than what we have now.
Yeah.
It shows how this issue is tied to this bigger debate. about the government's role in providing health care.
And it's not just some abstract idea. It's about real people's lives.
Yeah.
And whether they can get the care they need.
Exactly.
And we see that in some of the personal stories in the thread. There's this one user, a single dad, who talks about losing Medicaid coverage for his son who has autism.
Oh, wow.
And he blames what he calls the inept Florida government. And then there's another user, also in Florida, who describes her struggles. Just trying to navigate the Medicaid system.
It can be.
She says it's been insane.
Yeah, I bet.
These stories really give a human face to those statistics.
They do.
They remind us that there are real families behind those millions of children who lost coverage.
Right. Families who are facing real challenges.
Yeah.
Anxieties, uncertainties.
And that brings up another thing that I saw on the Reddit thread, this fear of what's going to happen to Medicaid in the future.
Yeah.
A lot of users are worried about potential cuts to the program under the new administration.
That's understandable.
I mean, we've seen proposals to reduce Medicaid spending, and that uncertainty is definitely causing anxiety for people who rely on it.
Of course.
Some users are even worried about the impact these cuts could have on vulnerable populations. They're predicting that it'll lead to more people struggling to get health care and maybe even facing some really bad consequences.
It's important to remember that these anxieties are coming from real experiences.
Yeah.
People are seeing how changes to the system can directly affect them and their families.
You know, we've been talking about these big trends and policy discussions, but I want to come back to Isabella's story for a minute.
Okay.
Because her family's struggle to get her coverage back really shows the human cost of these policy changes. It's not just about numbers. It's about real children like Isabella,
Right.
who need access to care.
Right.
It's easy to get lost in the statistics and the policy debates, but we can't forget.
What's really at stake here?
Exactly.
Children's health and well-being.
And even though there's a lot of frustration and anger in that Reddit thread, there are also some signs of hope and solidarity. People are offering support to each other, giving advice, and just listening.
That's good to hear.
It reminds us that even when things are tough, communities can come together to help each other out.
Absolutely.
And we've seen that kind of advocacy in the thread, too, with people talking about possible solutions, like universal health care, of course,
Right.
but also things like making the Medicaid enrollment process easier or giving community health centers a bigger role.
Interesting.
It's like everyone's trying to figure out how to solve this complicated problem together.
Yeah.
And even if not every idea is perfect, the more we talk about it and explore different options, the more likely we are to find solutions that work.
I agree.
It's about using the knowledge and experiences of all these different communities. And that brings us to a question for you, the listener. What do you think? What are your takeaways from all of this? We've talked about how big this problem is, the impact on families and kids, the complexities of policy, and all the different opinions people have. So now we want to hear from you. What stands out to you? What questions do you have?
Wow, we've really covered a lot in this deep dive.
We have.
From these really sad stories, like Isabella's, to all these big policy discussions about Medicaid. And it's clear that this is a complicated issue with no easy answers.
Yeah, there's no quick fix here.
And that's why it's so important to talk about it and really try to understand all the different sides of it.
Right. We can't just simplify things or rely on easy solutions.
We need to look at the details and understand where everyone's coming from.
Exactly.
You know what really hits home for me is that this isn't just some abstract policy issue.
It's not just about the rules.
Right. It's about real families, real children whose lives are being affected.
Whose lives are being changed.
By these decisions. Yeah, we can't forget that the human element is so important.
It is.
So as you think about all of this, remember those faces and voices we talked about today?
Yeah, like Isabella.
Like Isabella and her family? The parents on Reddit sharing their struggles?
Yeah, those real stories.
Those real stories.
And remember that there are people out there working on this.
Yes.
Advocates pushing for policy changes. Doctors and nurses making sure kids get care. People who really care.
People who are fighting for a better future.
And as we finish up this deep dive, I want to leave everyone with a thought. We've talked about different solutions. Universal health care, streamlining enrollment, expanding community health centers. But what else is there? What other ideas can we explore?
That's the big question.
Yeah.
And there isn't one right answer.
I think the most important thing is to keep asking these questions.
So keep searching.
And to never forget that healthcare should be a right, not a privilege. Thanks for joining us on this deep dive. We hope this got you thinking and inspired you to learn more about this really important issue. Remember, your voice matters, and you can make a difference.
Until next time, stay curious, stay engaged, and keep those conversations going.